something above your power, just try to focus on the positive, learn mindfulness, meditate, think of all good things. Think does thinking cause hypertension? Before we go in depth into this topic, let's talk about what blood pressure is, what high blood pressure is, or what hypertension is. Blood pressure is simply the force of the blood moving from the heart and the exertion of the movement of the blood from the heart through the arteries or through the arterial walls. Simply put, blood pressure is simply the force of blood against the walls of the arteries. Right? Do you get it? What are arteries? Arteries are the tiny tubes in the body that carry oxygenated blood away from the heart or nutrients and oxygens from the heart through different parts of the body. And this serves as a form of nourishment for the body and ensures that everything like regulation and all goes well accurately in the body. Back to topic. So, blood pressure is measured in two values, the diastolic and systolic pressure. The systolic pressure is the upper or higher value, while the diastolic pressure is the lower value. Systolic pressure is when the blood is moving from the heart through the arteries, like this, when the heart's pumping the blood. While this diastolic, the lower value, is when the blood or the heart is at rest. So there is no pumping action at this time. The range, according to American Heart Association, of blood pressure is that a normal blood pressure should be less than 120 for the upper value and less than 80 for the lower value. So that will be elevated blood pressure will now be between 120 to 129 when it's above 120 milliliter per mercury, and the lower value is less than 80 to 89 milliliter per mercury. Most people or some people operate very well at blood pressure of 100, 110, 117, 120. Good. Their blood pressure is within the normal range according to American Heart Association. So before high blood pressure can be established, your blood pressure needs to have been measured like three consecutive times for to get a particular reading for the establishment of hypertension or high blood pressure. So that brings me to the definition of hypertension. What is hypertension? Hypertension is a persistent increase in blood pressure upon measurement. So if your blood pressure is measured today, it's more than 140. Tomorrow it's more than 140. The day after it's more than 140. It means that it can be established that you have high blood pressure. So there are different stages of categorizing high blood pressure or elevated blood pressure. The first stage, as I mentioned earlier, is known as elevated blood pressure. The second stage is known as stage 1, stage 2, and critical blood pressure. Elevated blood pressure is blood pressure that is within 120 to 129 millimeter per mercury and less than 80 millimeter per mercury. So yes, something like 120 80, 120 70, 120 69, 129, 127 80, something like that. So high blood pressure, this is known as stage 1. It is when the blood pressure is within the range of 130 to 139 millimeter per mercury or 80 to 89 millimeter per mercury. So high blood pressure stage 2, this is when the blood pressure is 140 millimeter per mercury or higher. So you have something like 140, 142, something like that. And then the lower value, the diastolic, is 90 or higher. So it can be 140 90, 142 92, 142 95, something like that. So now to the critical stage, known as hypertensive crisis or emergency, is when the blood pressure is above 180 millimeter per mercury. That's for the systolic, and diastolic is higher than 110, 120 millimeter per mercury. The only way you can know what your baseline or what your usual blood pressure is by measuring your blood pressure. You need to have you need to have the machine. You don't necessarily need to go to the hospital before you measure it. You need to have a machine at home because blood pressure is known as silent killer because sometimes you do not even know the symptoms because the symptoms are similar to so many other things. But when you measure it regularly, you know what your baseline is, you know how you feel, whenever the blood pressure is high or maybe when it's low. Thinking and blood pressure. In today's fast-paced world, stress and anxiety it has become a major part of everyday lives. Chronic stress and excess anxiety can lead to excessive thinking, and this can lead to elevated blood pressure. And if care is not taken, an elevated blood pressure can eventually lead to hypertension. What are the symptoms of high blood pressure? Before we go into that, what are the factors? What are the things that causes blood pressure? These factors contribute to development of high blood pressure. One, genetics, family history of high blood pressure, then age, older. It's actually common in maybe age 60 and above. And when you're age 60 and above with high blood pressure, or it helps you to know if you have risk for any future cardiovascular problems, that is anything that deals with the blood and the heart. So, so I've talked about genetics, age, your diet, your lifestyle. If you take high sodium diet, low potassium diet, sodium is salt. It can, because of sometimes the body's genetic ability to absorb salt, because it's high blood pressure. So let's move to the symptoms: headaches, dizziness, chest pain, nausea, vomiting, feeling of unease, sweating. All these are symptoms that you can experience when your blood pressure is critically high. When your blood pressure is high, sometimes you may not even know. So please check your blood pressure regularly. What should you do in case you have noticed that you have elevated? The elevated blood pressure is when the blood pressure is at 120. So when you notice that your blood pressure is above 129, what should you do? You need to take note of your diet. You need to take note of your lifestyle changes. You need to be sure of your family history. If you have a family history of high blood pressure, ensure that your diet is low sodium, low salt. Ensure that your lifestyle, you do not do a sedentary lifestyle. You do not sit at your desk all day. Learn to exercise, move your body, take breaks in between works. You take maybe like 5 minute walks, walk around. Ensure that you are active. So lifestyle changes, diet changes, dietary changes. Yeah, these are the things you can do. Ensure that the stress source, whatever is putting you at stress, is dealt with. And if it's something above your power, just try to focus on the positive, learn hate, think of all good things, think of things that you would love to achieve, things that makes you happy, and this kind of way help to reduce the stress level you are currently feeling. Thank you for watching this video today. Join me in my next one. We'll talk more on food to eat in high blood pressure.